take it away, guys.
Thanks so much, Sarah. So I think everyone can see the slides. They're coming up for me as well. As Sarah mentioned, we work with the Epiwin team, so it's the Information Network for Epidemics. And today we really want to discuss engaging with networks in health emergencies, preparedness and response. So of course, we're talking about COVID, but we're thinking about health emergencies at a larger scale and in terms of preparedness as well. So next slide. For us, what's really important is these networks. So when we say networks, we mean large global networks, regional, also local networks, but we typically are working at the global level about partnership. It's kind of a key guiding principle, as well as all of these listed here. So when we prepare and respond to health emergencies, it really requires a whole of society approach, and probably a term you've heard throughout this pandemic response. And this is something we want to build during peacetime as well. So these partnerships really need to be continuous, and they're historical as well. WHO has partnered with various networks and groups throughout time, and we want to maintain those relationships over time. To really have these trusting, collaborating relationships, we must listen to the networks and the experiences that they have to understand what information is needed and how to best share that. This involves two-way dialogue. So we want to, constantly have a feedback. It's not one way. We're not just speaking to the networks and sharing information. We're also getting a lot of information back from their experiences and what's working for them. And this allows us to be more responsive in our work. It's really important to have mutual respect. So we have complementary strengths. Obviously, for example, the Faith Network has different experiences and strengths than WHO has. And in that way, we complement each other. It's very important to nurture trust. Trust is really key. As we know, these are uncertain times, and in uncertain times, trust becomes very important. And I'm sure throughout this infodemic training, you've discussed trust quite a bit. And we understand that to be, respecting human rights and equity and solidarity, especially for the most vulnerable. So it's a foundational part of our partnerships. We must be open and transparent, of course. As we've seen just in the last week, a lot happens in a health emergency and things change quite quickly. So we need to acknowledge what we know and what we don't know. And that also maintains a trust and the effectively sharing throughout the partnership and being honest throughout. And ultimately, we have to be adaptive. So we'll discuss this a bit more, but all of these partnerships and networks, they're unique in themselves. And so we need to adapt and engage. Our engagement must be tailored to the needs and concerns of each network. And so we do this as circumstances evolve as well. Next slide, please. So when we say we work with networks, we'll use the terms networks and communities quite interchangeably. For Epiwin, this approach is really about kind of this mutual engagement between these large networks and ourselves, and it informs our work and hopefully informs their work. So networks are communities. They're connected at the global level, also regionally, nationally, and locally. They're where trust is built, as I mentioned before. So usually during times of uncertainty, people who were trustworthy before a health emergency remain trustworthy over time. So this is where you find network and community leaders play a really critical role. Networks also represent and include large populations of the world. And these populations usually have unique histories, interests, and experiences. So for example, here we have, the 84% of people in 2010 were religiously affiliated. So that's a lot of people that are part of the Faith Network. Of course, these numbers can change, but it's just an example of how some of these networks really are far-reaching. As mentioned as well, network and communities are influential conduits of information and collaboration. So they're kind of like the influential glue that hold communities together in health emergencies and also in peacetime. That role is important in both times. And so that's why we're talking about preparedness and response in health emergencies and why networks are critical in that preparedness and response. And these community leaders and network leaders, they really help to guide people and lead people through crises. That could be through adapting, the scientific literature and information that's needed, and also helping people cope with uncertainty. Networks also represent the needs and the concerns and experiences of different groups. So for example, in the world of work, we have employers and employees, we have human resource networks. So there's a lot of different experiences that might come under our umbrella, and then that can be further dissected. But often when we're sharing information, it's what information is needed by that network specifically. Go to the next slide. So this is just a bit of an overview of WHO Epiwin's kind of big buckets of work. So we're going to go through some case studies next, but we work with a faith community network, youth engagement network, health in the world of work network, and science translation network. So those are the four main networks that we work with, and they cross over, of course. You'll have youth in the faith, you have science translation within the world of work. So there's a lot of crossover, which is fantastic. But those are the big buckets for networks we work with. And then we also have under science translation webinars and slide sets. So we've had technical information shared throughout the pandemic in a way that's understandable and accessible by the public. And ultimately, we have a really exciting project in the Hive information platform, which will be discussed later on. And that is a really great way of bringing together all this kind of work and having a place for networks to share. Go to the next slide. So of course there's challenges, but we have responses to these challenges. And I think it's important to identify the challenges in this type of work in working with networks. They're all unique in context and infrastructure and their expectations. And so our methodology aims to be responsive to these differences. And we interact with these different networks in different ways as is most suitable. And that can change and evolve as things become more formalized and change throughout a health emergency. As you know, WHO is a UN agency, and so we connect nations and partners and people to promote health, ultimately to keep the world safe. So this Epiwin Networks is an embodiment of that mandate, but of course to be successful and to have intersectoral collaboration and cross-country collaboration is complex. So we always try to aim to collaborate both with these networks and our regional and country offices because there's a lot of important experiences and knowledge in the regions and countries. So we want to make sure we include everybody and get the understanding and the partnership at all levels. Of course, we have a long history of community engagement and collaboration with civil society at WHO and in different sectors. But this work has sometimes been fragmented over time in different periods of health topics. And what we really want to see and what we're working on building is that networks and these collaborations are maintained throughout time. So they don't start and stop with the health emergency. We must continuously collaborate. Of course, with preparedness, we're also talking about, universal health coverage and things like that. So this is about long-term relationships that we always will work with. And we want it to be inclusive and sustainable. And that's what we're working towards. Now, just my last slide, slide 6 here about the Epiwin methodology. Really, these are kind of the 4 key approaches that we have to this work to strengthen and engage collaboration with these global networks. And the first is to recognize and promote a whole society approach that ensures diverse representation, that emphasizes unity, equity, and solidarity. The second is to convene these networks. So that's something that WHO is well placed to do, is to convene these networks so that these community leaders and decision makers can access trustworthy information and share best practices. There's a lot going on around the world, a lot of incredible innovative solutions happening, and we want to make sure that those are cross-pollinated. 3, we co-create and tailored products. These could include webinars and solutions with these communities that address the infodemic and are guided by evidence. And 4, we engage with communities to share accurate information and build resiliency to misinformation, thereby strengthening their role in health emergency. So these are the 4 main approaches that we use at Epiwin. And now I'm going to hand it over to Kat, who's going to go through some case studies about each of these different methodologies. Thank you.
Thanks so much, Alex. So my name's Catherine Sheridan. I'm also working with Sarah and Alex in this Epiwin team. And I'm going to take you through some of the case studies building out the methodology that Alex described. So the first is recognizing and promoting a whole of society approach that ensures a diverse representation, emphasizing unity, equity, and solidarity. So these are the key communities that we mentioned before that we're working with, and the networks span across all of society. Their work is at grassroots levels all the way to advocacy and policy at the international level. So we have here, I'll go through a few of them. Faith, there's a diverse group of faith leaders, faith-based organizations, partners, and faith communities of different traditions playing an important role in society. Including spiritual support and delivering services, increasing social cohesion, building resilience, communication, and advocacy activities. So throughout history, religious leaders, faith-based organizations, and faith communities at all levels have played a key role in health emergency preparedness and response, and in many places in the ongoing delivery of health services. Another one is our youth. So young people around the world continue to show an amazing amount of resilience in the face of the COVID-19 pandemic. Despite loss of lives, social restrictions, interruptions to their education, their job, security, and more. So as I've got here, they will be the future leaders in this recovery and preparedness. And as the current leaders in global health, we have an obligation to include them in our decisions now, and that will impact their future. We also need new ideas and innovation and change makers, and young people continue to prove themselves. So the health and the world of work. So the world of work impacts and includes almost everybody in the world. Decisions made by employers, workers, businesses, supply chains, labor, public health authorities, and essential economic sectors have significant impact both on people's health and livelihood. And the last one we've got here is science communication. So translating science into messages, recommendations, and actions that are easily comprehensible, accessible, and relevant is so important to this, so a vital element to this public health, to this emergency preparedness and response. So an ongoing dialogue between researchers, the public, the media, and health workforce is crucial to understand, to build trust and engagement in science and public health measures. So I'm going to take you through a little bit more of concrete examples of how we engage with these networks during the COVID-19 response. The second methodology is convening networks, so the community leaders and decision makers can access trustworthy information and share best practice for pandemic preparedness and response. The first case study is, again, the world of work and how they've applied this approach. So employers and workers have experienced an enormous amount of upheaval due to COVID-19, due to the pandemic. The world of work has quickly had to adapt, provide guidance to their employers, safeguard workers, adapt to the changing economies, regulations, all within the context of so much unknown and changing information. So at the end of last year, in November, December, we held a series of dialogues to take kind of stock of some of the lessons learned for future epidemics. So we invited representatives from across the sector in the world of work to share and consolidate their experience responding to the pandemic. So strong reoccurring themes of collaboration came out in different forms, and also the need to strengthen networking and knowledge sharing to enable people to take informed action, placing health at the center of preparedness and response. The next case study I'm going to talk to you about is the Science Translation Network. So after the WHA, the World Health Assembly this year, there was a resolution to urge member states to take measures to strengthen health literacy and to counter misinformation and disinformation and stigmatization, including by providing access to other sources of fact and science-based information. So WHO convened a global conference, or our team, on communicating science during health emergency. We brought together partners and colleagues working in research, media, policy, and practice to share examples of good science communication, challenges they encountered during COVID-19, and to create this multidisciplinary network of science communicators to be called upon for future science communication activities, including preparedness and response. Okay, the third methodology or approach that that Alex mentioned is to co-create tailored products, webinars, and solutions with key communities that address the infodemic and are guided by evidence. So, thank you, Sarah. Over the last couple of months, our team has been co-hosting a conference with Religions for Peace and our EPI-WIN faith communities of practice. The conference looks at strengthening national response to health emergencies within the coordinated work of WHO, religious leaders, faith-based organizations, faith communities, and national governments. This conference, held since October and still ongoing now, Actually, we have one of our last sessions today called Building Trust, Faith Leaders Engagement in Vaccine Confidence. So I'm sure perhaps a colleague could drop it in the chat if you wanted to join today. This conference has been a discussion of sharing of best practices on key topics, including spiritual care, country collaboration, and communication and advocacy. In addition to that, over the pandemic, we've been working with faith communities and their existing trusted networks to develop guidance and recommendations in the context of COVID-19. We use their support and their engagement to develop, adapt, translate, and share accurate health messages in ways that resonate with their faith communities. The outcome we have is these 2 guidance and recommendation documents. So we've got here the WHO strategy for engaging religious leaders, faith-based organization, and faith communities, and in health emergencies, and practical considerations and recommendations for religious leaders and faith-based communities. So I encourage you to take a look. The second case study I wanted to talk about was with youth. So last year in October, Epiwin launched a design lab inviting young people to reimagine our messaging around reducing transmission. Within 1 week, we had 79 young people submit in 28 creative ideas. Their products that they made were really unique and diverse, while also maintaining the scientific integrity of the messaging and WHO recommendations. So here we can see this. I've got a little icon here for Checkmate COVID, and this is one of our winning submissions, where she took on the 5 steps to protect yourself and reduce transmission, inspired by the Queen's Gambit, which is a Netflix hit about chess. And then the other example I wanted to talk to you about was a research study that we've been doing with youth networks, with youth networks. So we've partnered with youth networks and held discussions with them over the last couple of years, or almost 2 years now. And so, yeah, together we designed and implemented this rapid survey, which provided a snapshot of the called COVID-19 Youth Survey on Misinformation and Impact on Life. And this provided a snapshot on attitudes, knowledges, and awareness of young people towards COVID-19. Okay, and the last methodology that I wanted to talk about, or the approach, is engagement with communities to recognize trusted information sources and build resilience to misinformation, so thereby strengthening their role in health emergency preparedness and response. And this is an example I want to talk to you about is the faith community again. So we've been working throughout the pandemic hosting briefing sessions with various WHO experts to answer questions directly from the faith community and inform the pandemic response and advocacy work. This has been really interesting discussions where we gained such critical insight into what's actually the questions that have had by the community. So it's been fantastic to have this direct connection, as Alex said, this feedback and response loop. So we also shared latest accurate health information for faith partners to adapt according to different faith literacy level and different channels of dissemination. Of course, we've been working with these communities and communities of practice, and we've been co-convening messages around this, around communicating, around the topic of communicating this public health measures and vaccine information. Okay, so I'm going to leave it there as time is short and hand over to my last colleague, Judith, who will talk about a few other activities that we're involved in. Thanks.
Okay. Thanks very much, Kat. So my name is Judith van Olsen. I also work in the Epiwin team. So I will quickly, because of time, touch upon another part of Epiwin's work to reach communities with accurate and easy to understand information. So since the beginning of the pandemic, Epiwin has published weekly updates on topics related to COVID-19. And these updates come in the form of short PowerPoint presentations, and they summarize the latest science around COVID-19 or the latest WHO guidance. So they use a lot of graphics and pictures to clarify scientific concepts, and they are reviewed by WHO technical units to make sure the information is concise, but that it's also accurate. They are accessible to everyone and can be found on the Epiwin webpage. So in addition to these weekly updates, we also host webinars, usually on the same scientific topics, and they're also open to everyone who would like to join. So far, we have hosted 120 webinars, reaching more than 69,000 participants in about 149 countries. And so WHO's experts explain that, for example, during these webinars, so what do we know about COVID-19 and influenza? For example, how do vaccines work? What is the latest on booster doses and for example, COVID-19 variants? So we might soon have a webinar on the Omicron. And so even though some of the topics can be quite technical, we always make sure that our experts explain concept and science in language that is understandable to all. And recordings can be accessed through the Epiwin YouTube channel. So next slide, please. Yeah, thanks. So as said before, finding accurate and trustworthy information is very important and was brought up as one of the challenges by all networks during the pandemic. So another project that the team is working on is the Hive platform. So the idea is for WHO to provide a tool for communities where they can find trustworthy information. And this is also a tool where communities can share knowledge and set up and maintain collaborations within their own communities, but also, for example, for interprofessional exchange or for inter-community exchange, inter-network exchange. And the Hive platform will also be able to host events such as webinars or consultations. And if everything goes well, it will be launched the beginning of next year. And you all, please do contact us if you are interested to learn more about this, about the Hive platform. And then the last slide, please. Yes, thank you. So this is the last slide, and here we come to the key takeaways. So the first one is that collaboration is important in promoting health. This is not something that WHO can do on its own. WHO needs to work with countries, partners, and people to promote health, keep the world safe, and serve vulnerable communities. This is especially important during health emergencies, and the networks we spoke about enable this collaboration. Secondly, networks are communities convened around a common history or common values, objective or interests. And each of these networks we work with brings a unique contribution to emergency preparedness and response. So that's why they're all equally important to us. And the last message is that building and maintaining trust, partnerships, capacities, and systems should start in peacetime, before a health emergency occurs. This is a very time-consuming process, and engagements must be sustained outside of a health emergency. So after COVID hopefully ended, this should be maintained, and trust must be nurtured. So on that note, I would we end this presentation, and we're very happy to take any questions. And I hand back over to Tina.